Medical experts say 50% of people who get COVID-19 develop long-term effects known as long COVID. Symptoms range from joint pain to brain fog. But has that changed with Omicron? Sarah Hammond has that story.
2 years into the pandemic, thousands have experienced what's called long COVID-19.
I had weird symptoms. My throat was swelling up. It felt like I had postnasal drip. It just went on forever.
4 weeks after having the initial strain or the Delta variant of the virus, you could develop physical or neurological symptoms.
Fever, shortness of breath, fatigue, headaches, arthralgia, so joint pains, and myalgias, which are muscle pains. They can kind of have this brain fog.
As for Omicron, Dr. REBEKAH SENSENIG, infectious disease specialist with Riverside Health System, says it's too soon to say for sure if we'll see those same long-term effects, but she says it's very likely.
Omicron being mild at this point doesn't give me any reassurance that we're not going to have long-haul COVID in the future.
She says the severity of the illness doesn't determine if you'll develop those symptoms later on.
People can have a very mild illness and still go on to develop long-haul COVID.
SENSENIG says this is yet another reason why trying to catch Omicron just to get it over with is a bad idea.
But again, Omicron being mild, like the CDC director said yesterday, it's milder than Delta, but it's not necessarily a mild disease. And, our hospitals are full of very, very sick people with Omicron variant COVID.
Dr. SENSENIG also says it looks like COVID-19 cases are on the decline here in Virginia, but we won't know for sure until a couple weeks from now. For 13 News Now, I'm Sarah Hammond.
Dr. Fauci says the country could reach the Omicron peak in mid-February, but Dr. Sensenig says she is concerned that our plateau will be higher than it was with Delta. That was the case in the UK and South Africa when they had a steep decline in cases.